Hey everyone, this is Andrew Kissin, Senior Marketing Manager for Zahn Dental. We're here with Bennett Napier with NADL. Bennett, we sat down about 2 months ago to do a similar tech talk, and the industry has completely changed. The world has changed. We're in the middle of a pandemic and COVID-19. What are you hearing and seeing regarding dental labs and maybe the most updated information for the dental lab industry?
Sure, Andrew. Just first and foremost, want to thank you and the Henry Schein and the Zahn Dental team for the communications that you've been putting out there to your customer base and the industry, just to keep people in the loop on a lot of moving parts. And so y'all have done a great job keeping people abreast of the key issues that are of importance. So I'm happy to talk with you a little bit today to talk about a couple of those. As we are here as of April 21st, I'd certainly say people are trying to look at, what does the next 3 to 4 weeks look like? And so I would encourage people, we're working collaboratively with the ADA and other dental groups. Obviously, we're all kind of in this together, if you will. But for dental laboratories, I think it's important just to give some reference points. On our NADL.org news page, we have a link from the ADA that's updated daily, and it's a state-by-state spreadsheet that shows when dental practices are due to open back up for normal care, if you will, and services. So about as of today, 21 states are still, unless orders change, April 30th, 21 states dental practices would open up back to normal access to patients for multiple case treatments, if you will. 15 states would open up sometime in May. Some are May 1st, some go into mid-May, some into May, but in the May month, 15 states. 5 states in June, which a couple of those are more on the West Coast. And then 9 of the states, and then there's Puerto Rico's in the mix too, but don't have dates set. Most of those that haven't set a specific date for those orders effectively are smaller states, with less COVID cases and in many cases smaller populations. So I would say that those states are probably going to open up faster than obviously some of the states we all have seen on the news, like New York and New Jersey and other states, Michigan. So that gives some people kind of some context on, depending on where their clients are located, what that looks like for them as the laboratory, and kind of in terms of production and obviously just communication expectations and things as their clients open back up. So that's an important resource that people obviously should look to. And like I said, ADA is updating it daily, and we've got a link that links directly to that so that people can get the daily updates to that. The Paycheck Protection Program is obviously another continuing topic that a lot of laboratories are looking at. If we look at social media, not only for the laboratory industry, but just small business in general, there were, thousands of businesses, if you will, that applied that didn't get funding in the first round of that particular program. So, I have expectations that Congress, by the end of this week, will approve the next round. With obviously the president would sign that, and so we would encourage people that, especially if they had a loan application in for round one, just to stay in communication with their banks, because effectively anybody that was in the queue before, those banks are probably going to push those loan applications faster, especially if all the underwriting guidelines had already been approved. So just make sure people stay in contact with their banks. It's possible that somebody who didn't apply in round one, potentially, depending on where they're located, especially if they're in a smaller area with community banks where there's less businesses in that area applying, potential that they could apply and potentially get in the round two funding. So we would just encourage people to continue to do and look at that as a resource. Certainly the other program, the EIDL program, that's also appears to have some additional funding that will come forward for those that didn't apply in the first round for that too. And the Paycheck Protection Program, obviously most people are focused on that because it's a forgivable loan. if you utilize that for payroll and healthcare and rent expenses during that 8-week period from the point that you actually get the money from the lender. And so that's definitely one that people continue to focus on. We saw, unfortunately, a lot of labs that had applied and didn't get it in round one. But we also definitely heard from quite a few labs that ended up getting it, especially in that last 24 hours, as the funding kind of ran out, if you will, from the phase one. So that's an important piece for people to have that. Just I'd say in just other parts of things that we're getting lots of questions about, we'll be adding some additional what I call frequently asked questions to our NADL.org news page. Our highest attended webinar during the last few weeks was related to infection control and personal protective equipment, not only for the laboratory, but for the clinical practice and what that looks like post-COVID. So our partners at SafeLink Consulting did a great job. Probably have about 40 questions that were kind of the key questions that were people were submitting by social media and the webinar that we held. So we've got all those questions answered pretty good detail. So that's going to be a good resource document, not only for the laboratories to have for their own personnel, but also a lot of it focuses on the clinical setting of, what's the expectation in terms of transfer of, traditional impressions and all those types of things that will be important, and especially when a technician or a delivery driver goes into the practice setting, what are some of the expectations and protocols that they would want there. So I expect that will be a highly utilized document, as things start to open back up.
Yeah, and you started with the states that are opening, and that's step one, practices opening. Step two, labs getting back to full staff. But how do we get the patients back in there? That's got to be the question that everyone's wondering. Who's running out and when to go get dental work? And I think that's going to be a question that nobody's going to have the answer until we're back.
Right. I mean, it's going to be interesting to watch, to say the least. I mean, I think everybody's eager to get back, but also people are cautious. And when I say people, I mean assistants, hygienists, patients for sure. If we follow social media, there's definitely a big push from the assisting community and the hygiene community to ensure that their practices, for their own safety, have enough PPE, let alone the protocols that they might need to put in place for the patients to come back. So, I think you'll find hopefully some quick action with all the allied parties to hopefully focus on the right and very clear guidance of what is needed, and what are the reasonable expectations and precautions that should be there. I agree that we've got to instill consumer confidence, because if the patient's not confident of the safety of that practice, they're not going to come right back. They don't want to be the first person back. So, I think laboratories as a partner to their clients can definitely try to help on marketing and collateral material messaging, especially as it relates to restorative care. To talk about when things are coming back from the dental laboratory, speak to what protocols the laboratory has within its own environment for disinfection and protocols, so at least they understand what that looks like. That's another big puzzle piece that labs clearly can help their clients with. And I think certainly just in terms of focusing on all the things that labs have always done with practices in terms of OSHA and or CDC guidelines, just making sure that consumers were aware that the clinical practices and laboratories already had standards. They have some additional precautions, obviously based on COVID, but they're generally prepared for this, and well equipped to provide a safe and effective treatment for patients as they come back. So I think it's just key that the clinicians and the laboratories work together on that messaging, and and as things progress, I think certainly patients will be able to glean what are the most important, what I call touch points, if you will, that patients are asking about. And again, throughout this journey, we'll learn more of what's important for them to have in terms of messaging, and then add to that as we go.
Yeah, I think patient confidence is going to be a huge factor here in how do dental labs, dental practices market or present all the new policies and procedures that no doubt they're going to have to implement to make sure that everyone is safe from the dental laboratory to the end patient. So I think it's going to be interesting. But if anyone can do it, dental labs in the U.S. Have been through obstacles and hurdles and have always been kind of the backbone of the dental community. And now it's how do they partner closer with the clinical side.
Absolutely. I mean, I think, certainly things like the Certified Dental Laboratory Program, which are primarily focused on OSHA standards, certainly labs that, have that certification designation already, that's a ready-made component that they could work with their clients on. And just even if they're not following something of that nature, if they have their own in-house protocols, is just laying those out in a narrative form and working with their marketing teams to provide, some, case box stuffers, if you will, that it can, from start to finish, that the clinician can not only have for their staff, but certainly the patient at the end of the process. So I think it's all about team, as it always has been, team, communication and collaboration across the spectrum is going to be crucial. And I think certainly I've talked recently, just what does this mean for digital dentistry? I think certainly you probably will see some surge, if you will, in terms of digital dentistry and digital impressions. Just again, if you look at removing, variables, if you will, that may cause some concern as it relates to, transference of bodily fluids, those types of things. Digital impressions can, to some extent, reduce some of those elements that are present with traditional impressions. So it'll be interesting to see how that plays out, if that will really kind of bring an additional springboard for the growth in that area.
Yeah, I mean it's that old debate of digital versus analog, and how does digital make a practice or a laboratory more productive, and maybe where you need to make changes to work schedules, to productivity, to the amount of people. It's just another opportunity to implement some technology into the laboratory.
Right, and I think it's important, as again going to the consumer confidence issue, and to some extent, when you walk into a shiny practice, if you will, that's kind of had some updates and it's got some new technology, from a consumer standpoint, your perception is, hey, this is kind of a new age dental practice, if you will, and it doesn't look like it came out of the 1970s. And so I think that's, although people may not have the discretionary, revenue to spend on improvements or technology, to some extent, that may be an investment that they want to consider, because that will potentially instill confidence for patients as they come back in, as they see, like, hey, this is a very very clean environment, and it's got high-end technology, which in a consumer's mind, all those things, as we walk into any type of establishment as consumers, when you see something that looks more innovative and progressive, if you will, it gives you confidence, and it kind of establishes some subconsciously some credibility in the nature of how that business operates. So dentistry is not going to be any different in that respect, and I think that will be helpful.
Bennett, we're in essentially month 2 of this pandemic, and the lab industry, like the world, has been flipped on its head. What advice or what recommendations would you have to your average dental lab that really hasn't been open for 2 months? What kind of advice would you give them?
Yeah, I keep using the term, look at the tools in your toolkit, and the tools can be, functional tools. Your tools can be people, all of the above. And so I think certainly the only way all of us are going to get through this is to, work with the resources that you have and maximize those resources. So, as we did before, find very good strategic partners, your supplier, manufacturer, distributors that are in the market. Find the ones that are aligned with your mission and vision as a business, and that you have confidence in, and that can provide you a wide scope of resources in terms of not only products but also services and business management acumen. Look at those partners that are available, because you need as many resources as available to you as a business to be able to move forward in a very effective and efficient manner. And so whether it's within the supply chain on that standpoint, but certainly as I've spoken with other groups, is look at your CPA, your bankers, legal firms, HR firms, utilize the resources that are out there through whether it's, dental laboratory associations at the state level, but also, certainly laboratory owners or business owners. So look at local groups like Vistage, where you've got CEO peer groups that maybe they've not been involved with that kind of program before, where you can work with people of like-sized businesses, but in different industries or sectors, where you can learn like how each of those groups are coping with the turnaround, if you will, with COVID. So I would just encourage people to look at the communities that are available, whether it's a social media community where we've seen a lot of good collaboration already in the laboratory community on that regard, but even at the local level, chambers of commerce. Again, there's lots of resources that are right in people's backyards that maybe they didn't tap into before. I would just encourage people to look what's right there in front of them and utilize as many resources as you can, because you're probably going to need them all. You don't need them all every day, but at some point you're probably going to need a resource in a particular area or a particular person with a particular skill set to help you guide through some additional things that we'll see down the road, as a result of COVID. So I think that's the biggest thing is, look at what's in your toolkit now. And if you find some things are missing, go out and find where those tools are and put them in your toolkit.
Bennett, thanks so much for your time today. There are updates that continue to come out daily. We appreciate you taking the time to give us the latest on how this pandemic is really impacting dental labs and dental technicians across the U.S.
Thanks, Andrew. And again, thanks for the Henry Schein and Zahn Dental for all of the work y'all are doing. Thank you very much.